Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to discuss Alzheimer's disease, including symptoms, stages, causes, diagnosis, and treatment. Please share this information with someone who is just beginning to exhibit symptoms. Alzheimer's disease is a brain ailment that gradually impairs thinking and memory abilities as well as the capacity to do even the most basic duties. The majority of Alzheimer's patients experience symptoms later in life. Experts believe that around 6 million Americans, the majority of whom are 65 years of age or older, may have Alzheimer's disease. Estimates vary. The most frequent cause of dementia in older persons, Alzheimer's, is currently listed as the 7th most common cause of mortality in the U.S. The loss of cognitive abilities, such as thinking, remembering, and reasoning, as well as behavioral skills to the point where it interferes with a person's day-to-day activities, is known as dementia. Dementia severity ranges from mild impairment of daily functioning to the most severe stage, where individuals require complete assistance with everyday tasks. In the early stage, the person's abilities are just beginning to decline. Depending on the exact type of brain abnormalities occurring, dementia can result from a variety of causes. Lewy body dementia, frontotemporal diseases, and vascular dementia are the other types of dementia. People with mixed dementia, which combines two or more forms of dementia, are not uncommon. For instance, certain sufferers of vascular dementia and Alzheimer's disease. What effects does Alzheimer's have on the brain? Researchers are still working to understand the intricate brain alterations caused by Alzheimer's. Brain alterations may start 10 years or more before symptoms manifest. In the early stage of Alzheimer's disease, the brain undergoes harmful changes with abnormal protein accumulations forming tau tangles and amyloid plaques. These alterations contribute to the disease's progression. Previously healthy neurons eventually die, stop working, and lose their connections to other neurons. Alzheimer's disease is also believed to be influenced by a wide range of other intricate brain abnormalities. The entorhinal cortex and the hippocampal regions, which are crucial for memory formation, appear to be the first areas of the brain to sustain injury. More areas of the brain become damaged and start to shrink as more neurons die. Brain tissue has greatly shrunk and there has been extensive damage by the time Alzheimer's reaches its last stage. Signs and symptoms of Alzheimer's disease. One of the earliest indications of Alzheimer's-related cognitive impairment is usually memory issues. Mild cognitive impairment, MCI, is a condition that affects some persons who have memory issues. Although patients with MCI experience greater memory issues than is typical for their age, their symptoms do not significantly affect their day-to-day activities. MCI has also been associated with issues related to movement and smell. Alzheimer's disease is more likely to strike older adults with MCI, albeit not all of them do. Some might even go back to thinking normally. The initial signs of Alzheimer's disease differ from person to person. In the early stages of Alzheimer's disease, cognitive decline may manifest in non-memory aspects like difficulty finding words, vision and spatial problems, and impaired thinking or judgment. These symptoms can indicate the onset of the disease before significant memory loss occurs. Researchers are studying biomarkers, which are biological indicators found in blood, cerebrospinal fluid, and brain imaging, to identify early brain changes. These biomarkers can help detect alterations in individuals with mild cognitive impairment, MCI, and cognitively normal individuals. The goal is to identify those who may be more susceptible to Alzheimer's disease. Before these methods can be widely and regularly used to diagnose Alzheimer's in a doctor's office, more study is required. Alzheimer's disease stages. Mild Alzheimer's disease. People with Alzheimer's disease have more memory loss and other cognitive problems as the disease progresses. Problems such as wandering, difficulty managing finances, repetitive questioning, taking longer to complete tasks, and changes in behavior and personality are common in Alzheimer's disease. These issues indicate cognitive decline and can significantly impact daily life. People in this stage are frequently diagnosed. Alzheimer's disease in its moderate stages. This stage is characterized by impairment to brain regions responsible for language, reasoning, conscious thought, and sensory processing, including accurate sound and scent detection. As disorientation and memory loss worsen, people start to have trouble identifying friends and family. They might not be able to pick up new skills, do complicated actions like putting on clothes, or deal with unfamiliar circumstances. People in this stage may also act impulsively and experience hallucinations, delusions, and paranoia. Severe Alzheimer's disease. In the end, the brain becomes completely covered in plaques and tangles, and the brain tissue is much smaller. Individuals suffering from severe Alzheimer's disease are utterly reliant on others for care and are unable to speak. When the body shuts down toward the end of life, the person may spend most or all of their time in bed. What causes Alzheimer's disease? The urge to gain a deeper knowledge of Alzheimer's disease has accelerated in recent years for scientists. Even so, the majority of people's etiology of Alzheimer's disease remains a mystery to scientists. Age-related alterations in the brain, in addition to genetic, environmental, and lifestyle variables, are most likely the reasons. Depending on the individual, each of these characteristics may have varying effects on the likelihood of getting Alzheimer's disease. The basics of Alzheimer's disease. To find out more about plaques, tangles, and other biological aspects of Alzheimer's disease, researchers are working on many projects. Advancements in brain imaging technology enable researchers to observe changes in brain structure and function in living individuals. They can also track the growth and spread of abnormal tau and amyloid proteins associated with Alzheimer's disease. This technology provides valuable insights into the disease's progression and development. Researchers are investigating the early stages of Alzheimer's by studying changes in bodily fluids and the brain that occur years before symptoms appear. This research aims to understand the disease process long before clinical signs are evident. The results of these investigations will facilitate diagnosis and advance our knowledge of the factors that contribute to Alzheimer's disease. Why Alzheimer's primarily strikes older persons is one of the disease's big riddles. Investigations into the natural aging of the brain are addressing this query. Scientists are finding that age-related brain changes, such as neuronal death and brain cell disruption, may worsen Alzheimer's disease. These findings suggest that the aging brain's alterations contribute to the disease's progression. Age-related brain changes include the atrophy of specific regions, blood vessel damage, and inflammation. Additionally, the production of unstable chemicals called free radicals and mitochondrial dysfunction, which affects energy production within cells, are significant factors. These alterations contribute to the progression of conditions like Alzheimer's disease. Health, environmental, and lifestyle factors. Studies indicate that a multitude of variables other than heredity could contribute to the onset and progression of Alzheimer's disease. For instance, there is a lot of interest in the connection between metabolic diseases like diabetes and obesity and vascular disorders like high blood pressure, heart disease, and stroke, as well as cognitive loss. We will learn more about if and how lowering risk factors for these illnesses may also lower the chance of Alzheimer's disease through ongoing study. Maintaining one's health as one ages can be facilitated by a balanced diet, exercise, social interaction, and mentally challenging activities. These elements may also lessen the chance of Alzheimer's and cognitive decline. Clinical studies are being used by researchers to examine some of these theories. How is Alzheimer's disease diagnosed? To assess if a patient experiencing memory issues has Alzheimer's disease, doctors employ a variety of techniques and instruments. In order to identify Alzheimer's disease, medical professionals may, when evaluating someone, it's crucial to ask about their overall health, including medications they take, their diet, and any past medical conditions. Assess their ability to manage daily tasks and any changes in their behavior or personality. Additionally, gathering input from a family member or close friend can provide valuable insights into their condition. Test your recall, critical thinking, focus, counting, and linguistic skills. In order to help determine further potential reasons of the issue, order blood, urine, and other regular medical testing. Test patients to see if their symptoms are being caused by or are exacerbated by depression or another mental illness. Take a spinal tap to get cerebrospinal fluid, or have blood tests done to determine the presence of proteins linked to Alzheimer's and similar dementias. Conduct brain scans, such as positron emission tomography, magnetic resonance imaging, or CT, to confirm an Alzheimer's diagnosis or rule out other potential reasons for the symptoms. To provide physicians with information about how a patient's memory and other cognitive abilities are evolving over time, these tests may be repeated. People with memory and cognitive issues should consult their doctor to determine if their symptoms are caused by Alzheimer's disease, stroke, tumor, Parkinson's, sleep disorders, drug side effects, infection, or dementia. A few of these ailments might be curable and even reversible. If Alzheimer's is the diagnosis, starting therapy as soon as possible could temporarily maintain everyday functioning. Early diagnosis aids in future planning for families. They can handle financial and legal concerns, deal with possible safety hazards, find out about housing arrangements, and create support systems. Furthermore, receiving a diagnosis early increases a person's eligibility to take part in clinical trials or other research that are evaluating potential new Alzheimer's treatments. How is Alzheimer's disease treated? Because Alzheimer's is a complicated disease, it is unlikely that all patients will respond well to a single medication or other intervention. Scientists are creating and evaluating a number of potential therapy approaches in ongoing clinical trials. Alzheimer's disease now has no known treatment, although new drugs are being developed to slow the illness's course by addressing its underlying causes. Additionally, there are drugs that can assist control specific symptoms and behavioral issues as well as temporarily enhance or stabilize memory and thinking abilities in select individuals. Aside from these behavioral and psychological symptoms, Alzheimer's patients may also experience despair, anxiety, agitation, insomnia, and other symptoms. Researchers are still trying to figure out why these symptoms happen and are looking at novel drugs as well as non-drug approaches to treat them. According to research, treating these symptoms may improve the comfort level of Alzheimer's patients as well as their carers. Experts agree that while some Alzheimer's patients may benefit from antidepressants, antipsychotics, and anxiety medications, these should only be used alongside other approaches to improve physical and mental comfort. Non-pharmacological strategies, such as avoiding stressful situations, are essential components of comprehensive care. Combining medication with these techniques can help manage symptoms more effectively. It's crucial to discuss with a physician whatever course of action will work best for you. Alzheimer's disease is a multifaceted and debilitating illness that impacts millions of people globally. In order to manage and support people affected, it is imperative to comprehend the causes, symptoms, and course of the condition. Even while there is currently no cure for Alzheimer's, there are ways to enhance quality of life. Future research could lead to more potent medications and, eventually, a cure. In order to address the difficulties caused by Alzheimer's disease and provide hope and support to patients and their families, it is imperative that there be greater awareness, early diagnosis, and thorough care. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.